Welcome to India TV, you're watching Health DNA. I'm Anshu Jay Singh. With us we have Dr. Durgatosh Pandey, surgical oncologist, Manipal Hospital. Welcome, sir. Sir, what is cancer?
Cancer is any unregulated growth of cells. The nature of the cells is to reproduce and divide. Now this reproduction and division of cell happens in a regulated manner. Once this cell escapes that regulatory phenomenon because of some mutation in one of these genes, etc., they grow in an uncontrolled fashion, and this growth is called cancer.
What are the signs and symptoms?
So the signs and symptoms of the cancer would depend on the part of the body which it affects. We actually talk about the common things which should lead to a suspicion or a fear of cancer in an individual. For example, any lump in any part of the body which is unusual and it has been present for more than a month or so. That is one. Any ulcer or a wound that refuses to heal. Again, arbitrary cutoff is a month or so. It does not heal in a month or so. Any cough, which is a persistent cough which is there for more than 2 weeks to 3 weeks. One should get investigated. It may be tuberculosis, it may be some infection, but it can also be a lung cancer or a cancer of the throat. For any unexpected loss of weight. So if there is more than 10% of loss of weight of an individual within 6 months, and if that person is not trying to lose weight, then it becomes another suspicious cause of, suspicious symptom for cancer. Any mole that changes its character. We have, many people have moles in their body. If a mole becomes bigger or blacker or gets ulcerated, starts bleeding, these are changes in the mole of the individual. Any difficulty in swallowing, again, is an important thing which one should be aware of. Then bleeding from any site of the body, other than the natural bleeding which happens in women in a form of menstruation. Bleeding from, let's say, in the stool, blood in vomitus, blood in cough. These are other things which should lead us to a suspicion of cancer.
So what are the common forms of cancer?
So if we talk about cancer and globally as well as in India, now within women, breast cancer is the commonest kind of cancer. Just about 15 years back, cervical cancer was commonest. But the screening of cervical cancer has, whether it is screening or the education and preventive aspects of cervical cancer which have taken roots, then cervical cancer has really reduced. Now the commonest cancer is breast cancer in women, and in men it is lung cancer. The commonest cause of mortality is lung cancer in men, and again in women also there is a competition between lung cancer and breast cancer as the common causes of mortality.
So what are the risk factors and how can we prevent or manage?
So if we talk about risk factor of a cancer, there are again modifiable risk factors and non-modifiable risk factors. We should focus more on modifiable risk factors. What are the modifiable risk factors on an individual basis? The commonest cause of cancer which we know of is tobacco. Tobacco in any form. It is such an important cause of cancer that if we remove tobacco from the equation, 40% of incidence will drop in one generation. It takes a generation for these effects to come in, but which means that tobacco is directly responsible for 40% of all the cancers. And tobacco in the form of smoking, in the form of chewing tobacco, this is the most important cause of cancer. The next one is alcohol. Alcohol now is a class 1 carcinogen. So alcohol is another important cause of cancer. Not on an individual basis, but on a society thing. Pollution, air pollution, water pollution, etc. are important causes of cancer. So these are modifiable causes of cancer, and then on an individual basis, the lifestyle factors, obesity, overeating, alcohol, smoking, etc., which we already told, sedentary life habits. These are important causes of cancer.
So what are the different stages of cancer and the treatment options available as per the stages?
So almost all cancers are staged from stage 1 to stage 4, and stage 1 is a local disease, stage 4 is when the disease has gone out of the confines into other organs as well. The treatment, the prognosis of each stage varies. Broadly, if you can see between stage 1 and stage 2, the chances of cure is 80%. Stage 3 and stage 4, the chances of cure is 20%. I am talking of all cancers combined. Unfortunately, in India, even today, 80% of cancers come to us at stage 3 or 4. And 20% come to us at stage 1 or 2, where the cure is absolutely reverse. In the West, they have managed to pick up cancers at an earlier stage, and that is the main reason why their outcomes are better than us, not because their treatment is better, but just because they find stage 1 and 2 more often than what we do. So this is about the outcome of stages. The treatment depends on the stage. Overall, it is a multidisciplinary aspect to cancer care, which means that all disciplines of cancer, which starts from surgery, radiotherapy, chemotherapy, any kind of systemic therapy which can be hormonal, targeted therapy, immunotherapy, etc. Palliative therapy. The palliative therapy is also extremely important when as an adjunct to the curative forms of treatment. Then there are other specialities which also pitch in, for example, intervention radiology, to take care of certain things which we do not really want to get into a very invasive surgery. So those things can be taken care of by intervention radiology as well. So all these disciplines combined lead us to a treatment of cancer.
So, sir, do you think that the treatment has evolved over the period of time, like today, looking at the advancement and all?
There has been a tremendous evolution of treatment in cancer. The technology has improved, the concepts have improved, and in all these disciplines, the surgical technology has improved, the concepts of surgery have changed. So previously, when we were talking about ablative surgeries, if there is a tumor in the bone, the only treatment is an amputation. If there is a tumor in the breast, the only treatment is a mastectomy. If the tumor is in larynx, voice box, the removal of the voice box. Now it is no longer so. There is a concept of organ preservation. So the surgery can be done in an organ preserving manner. Other treatments can be added as an adjunct. One, to improve the chances of cure, and second, in order to conserve the organ as well.
So you were just mentioning about the West and the detection process. Where do you see are the gaps in Indian context? And what do you think needs to be done?
India is a massive country, and India is not a homogeneous country. When we are talking about India as a country, we should compare it with Europe. So it is not India versus France or Germany or England. They are smaller than Uttar Pradesh. These countries are smaller than Uttar Pradesh. You have to look into India has to be seen as a continent. The most important part of this country is its huge diversity. There are some pockets of this country which have a excellent access to healthcare, and those places will have the results which are similar or better than any country in the West. When we talk about Delhi or Mumbai or Chennai or Bangalore, I mean this. There are other parts of the country which have no access to healthcare. Even today, the children would die of diarrheal diseases in those parts of the country. Now, this kind of a discrepancy in healthcare access is a very important factor. So this is the first gap that India has. The second is the resources that are available. We do not have resources to either screen individuals who should be screened for cancer, or to treat each and every patient in a very optimal way. India spends about 1.4 or 1.5% of its GDP on healthcare, which is one of the lowest in the world. And we compare it to United States, which spends about 15% of its GDP to the healthcare. And their GDP is much larger than ours.
Correct.
It is an unfair comparison. So these are the most important gaps that we have as far as the access to treatment and the efficacy of treatment across the country is concerned.
Talking about, cancer in Indian population, how prevalent it is?
The cancer in India, if we go to the statistics, about 1 in 9 people will have cancer in their lifetime. This is the statistics. If this is something which everybody will understand. If we go into incidence terms, it's about 100 odd per 100,000 population. This is the incidence per year of developing cancer in India. So this is the cancer burden. And again, about 100 per 1000, if that is the incidence, about 60 per 100,000 would die of cancer. So the mortality is also extremely important. So this is the cancer burden in India.
Ma'am, so how can we, make it accessible in rural areas?
This is a challenge which most of us grapple with, which struggle with those challenges, and unfortunately we do not have a very good answer to this. All good hospitals, if we look at into private setup or even public hospitals, most of them are in urban areas, in tier 1 or tier 2 cities, which already have a decent access to health care. Having said that, it's not that changes are not happening. We have Ayushman Bharat that has come up. We have Rashtriya Arogya Yojana which has come up, and these are important ways to improve the access of an individual to the treatment. The development in healthcare cannot happen in isolation. If you expect that a specialist doctor, an oncologist, should go into a rural place and actually work there, then it cannot happen in isolation. There has to be good schools there, good sources of entertainment, availability of all kinds of resources, the roads have to be good, infrastructure has to be good. So it happens as a well-rounded development. Only then those places will be accessible to the specialist doctors who would like to go there and work. If you compare to United States, no patient, very few patients have to go more than 100 kilometers from their place of stay in order to access treatment for any serious disease, including cancer. And if you come to India, then every patient, almost every patient travels about 500 kilometers or so to access treatment for serious diseases.
So how important it is to address the stigma around cancer?
Even now, working professionals would not like to reveal the diagnosis.
Correct.
I have had so many patients with me that they are singers, they are working professionals, they are scientists, they have had cancers, they have hidden themselves while treatment, and then they have moved out, they have not told to their own colleagues because of that stigma, and also because of the fear of losing the opportunities in the jobs, etc. So these things do happen. We have to be more supportive to those individuals as a group, as societies, as organizations, and that is the only way that stigma will go.
So on this Cancer Day, what is your message to the people out there?
The most important message on the Cancer Day, which I always emphasize, that stop tobacco. On an individual basis, do not fall into the trap of tobacco in any form, whether it is chewing, smoking, etc. To the governments and to the decision makers, please help in this fight against tobacco. It has been a long time, and the decision makers, the governments, they do act, but that action is not in proportion to the risk that we have. As I said, if we today make a decision to ban tobacco, that's an impractical thing which I am suggesting immediately. But let's for a moment hypothesize that today the tobacco goes away. In 20 years' time, the cancer incidence will reduce to half. One intervention has got this potential. What are we talking about? And then the people who tell us that a lot of finances are generated, it's a matter of economy as well. The tobacco generates economy. It is just the 4 diseases that have been calculated: cancer, cardiac diseases, pulmonary diseases, the lung diseases. Only 3, not 4. These 3 diseases, the cost of treatment has been calculated, and it is 3 times the revenue that tobacco industry generates. So it does not make any economic sense as well. So this is the foremost message that I want to give to the society and to the decision maker at large, that please stop tobacco. That is one. Second thing is, be aware of your own body. If there is an unusual finding, unusual symptom which is for 2-3 weeks or more, then please approach a doctor for diagnosis and healthy habits. These are the things which I would like to emphasize.
Thank you so much, doctor, for giving us your time. It was really nice talking to you. Thank you.
Thank you.
Thank you.